Characteristic sparing of the submenum and the anterior neck, and again the pigmentation along the sternocleidomastoid muscle down into the lower neck on the other side and extending down to and involving the anterior chest wall. Lots of sun damage, and Elizabeth is 50 years of age, so she's a prime candidate for this type of procedure. We're beginning on Elizabeth's upper neck, and you can see that this particular laser really gives a nice aiming beam. Now let's lift that back, and you can see that this is what one pass of this particular laser looks like right in here. I'd like to focus for just a few minutes on some of the technical parameters that we think about when we're initiating one of these treatments. The first thing and the most obvious is the spot size. The larger the spot size, the quicker we're able to do the treatment. So if we're doing somebody's full face, for most of the face, we'll use the largest spot size, which is 18 millimeters. When we're trying to refine the treatment for the area underneath the eyes, or maybe the area around the vermilion or the red portion of the lips, then we're going to use that smaller spot size there as well. And we'll go down as far as 3 millimeters. So again, the variation of treatment might be anywhere between 3 millimeters and an 18 millimeter spot size. Our next parameter that we're going to consider is how aggressive do we want this treatment to be. So we'll start thinking about density. With this particular unit, each little beam is 150 microns, and we can get almost that close to the next beam within this scanner, so that our density might be as low as 200 microns, which simply implies the distance from each pulse to another in our scanner. And that's a very important parameter. Most of the time I do my treatments, if I want to get fairly aggressive, between 200 microns and 500 microns on any particular patient. Then we have our power settings. Generally we're going to use either 18 or 20 watts. Obviously 20 watts is a bit more aggressive, so if we want to get more aggressive, we're up to 20 watts, a little bit less aggressive, a little bit less painful, I might say as well, 18 watts. And then we come to the parameter of duration, which is exceedingly important. The longer the duration of a pulse with any laser, then the more exposure that the skin has to that laser, and that implies depth of treatment. So if we're going to do 2 milliseconds of duration, then that's going to be a deeper treatment. We use that when we want to get particularly aggressive. This particular unit, we can go all the way down to 0.2 milliseconds, or we can go as high as 2 milliseconds. So again, the depth of your treatment is directly related to the duration of the laser pulse, and so the longer we're there, the more injury that we'll create. You know, we can see the erythema that is developing from the heat disbursement from this procedure. That'll fade over the next couple of hours. It'll look like a sunburn, probably kind of feel like a sunburn to Elizabeth, and should be a nice overall treatment. Now, you know, it'll be about 3-4 days before we really are going to allow anyone to use any kind of cover-up makeup, usually 4 or 5 days in many situations. So basically,